So you have been diagnosed with cataract and now you have to go for surgery. I am sure you will already have been explained everything that you have to expect on the day of your surgery. And if you have not been explained, do check out my video on what to expect when you are going for cataract surgery, which I have linked in the description as well as on the screen in front of me. However, do you know that even before your cataract surgery, there are certain things that you should be doing? So, in today's video, I am going to share with you 5 top important things that you should ideally be doing before, in the week before your cataract surgery. So, stay tuned for that. And now, the very first thing is if you are someone who has white hair and was planning to get hair color done, or you just normally like to get hair color, or you want to get a haircut, it is advisable that you do it at least 5 to 7 days before your cataract surgery. Because after your cataract surgery, you will be advised to avoid hair color or a haircut for at least 3 to 4 weeks. Now, this is generally done to prevent the risk of any kind of foreign body, such as the hair coloring material entering into your eye, which can result in inflammation, redness, watering. It can even result in a delayed healing response. So, if you want to get your hair colored or if you want to get a haircut, it is advisable that you do it before your surgery or you wait for at least 1 month after your cataract surgery. The next thing you want to do is avoid very cold or oily food in the week preceding your cataract surgery. Now, this is because oily food or the sour kind of food can actually cause you to develop a sore throat and you may get cough, cold, fever. Now, if a patient has fever on the day of surgery, the surgery will actually need to be postponed. And in order to get the next date for the surgery, it might be a tedious process for you. Also, if a patient has only cough with no cold or fever, the surgery might still need to be postponed. This is because coughing increases the intra-eye pressure or the intraocular pressure during the surgery, and this can result in complications at the time of surgery. So make sure to avoid sour food, cold food, oily food in the 1 week prior to your surgery so that your surgery goes smoothly. I'm sure many of you would be aware of this one. Well, you need to take a head bath just before your cataract surgery day. Like 1 day prior to your cataract surgery, go ahead and take a head bath or a head shower. Now, most of your doctors will advise you to avoid a head bath after your cataract surgery for at least a week. Now, this is done because all the wounds are still fresh and they are in the early healing stages. So, you don't want any of the tap water to enter into the eye, which can result in infection. Tap water or shower water generally has a lot of bacteria and pathogens, and in a newly operated eye, there is an increased risk of infections such as conjunctivitis and even endophthalmitis, which can occur in such cases. So, it is better that you take a head bath prior to your surgery so that you can wait out that 1 week period. Also, in the case of men, I would honestly advise you guys to go ahead and shave that beard, because after the cataract surgery, your doctors will ask you to avoid shaving for at least a couple of weeks. This is done so that the foam which you are using, the soapy foam, as well as small hair particles should not enter into that newly operated eye, as this foam and the hair particles can actually result in inflammation, again redness, watering, tearing, all this can happen. So do that before your cataract surgery. So the next important thing that you need to do is visit with your physician, especially if you're diabetic, hypertensive, if you have heart disease, or you're taking medicines for any kind of systemic diseases. Cataract surgery is done under topical anesthesia, and as such, none of the systemic medications need to be stopped prior to the surgery unless advised otherwise by your physician. However, your blood sugar levels, your blood pressure, everything needs to be within normal levels on the day of the surgery for the surgery to happen. Now, if these are elevated or they are beyond normal levels, then your surgery will get postponed. So do not leave visiting your physician till the last minute and get it done prior to your cataract surgery. Finally, the most important thing is that follow all the instructions that your eye doctor gives you. You will be asked to start certain drops such as antibiotic drops and anti-inflammatory drops 3 days prior to your cataract surgery in the eye to be operated. So make sure you are putting those drops, because these drops are meant to reduce the risk of infection as well as improve the dilatation at the time of your surgery. If you guys want to learn more in detail about cataract, what is the risk factor for cataract, what are the symptoms of cataract, and what are the treatment options available, do check out my video on understanding cataracts, which I have linked down in the description below. Also, do take out time to share this video with your friends, your family members, and other people you know who might be advised a cataract surgery, or so that they also benefit from this video. And I'll see you all again very soon in the next video. Stay healthy, keep those eyes healthy. Bye bye.